Tamiko here in St. Petersburg, Florida. Um, I just changed up a little things on my website. I changed the name to Welcome to Labor and Delivery because this is the book that I've been writing for years that I am finally forced to give birth to. The Black Sisters Guide to the Inner Workings of the Labor Room. This is going to be a short live, but I just want to reintroduce myself. Again, my name is Tamiko. I've been a labor and delivery nurse since um, November 2007. I passed my boards in February of 2007. I graduated from a school here in St. Petersburg, Florida, St. Petersburg College. I am working with my bachelor's degree. I am RNCOB certified through the NCC website. I have my fetal monitoring certifications through that um, website as well, credentialing. I am advanced fetal monitoring certified. I've been that since whew, a long time. I am ACLS certified. Now, do I know those heart rhythms? I don't because we don't use those. By the time a patient starts circling the drain, we already got the code team now. I am also BLS. That's something that every nurse should have. What else do I have? NRP, neonatal resuscitation. So if your baby come out floppy, I can at least start your baby CPR until the big guns get there. But because I'm a prudent nurse, and if I feel that I need extra hands, I will have them there at my delivery. I'd rather have them and not need them than need them and not have them. But I am turning this platform into my advocacy for Black women because I can't do it in the labor room. I'm being blackballed when I whistleblow, when I report things that should be reported because this is what they tell me to do. Me as a Black woman have been punished for doing this. Here in St. Petersburg, Florida, we have this local hospital here in our community. I was hired September 13th, 2022 as a staff nurse night shift. And after my first disciplinary write-up, which was August the 16th of 2023, all hell broke loose. And I had over 26 write-ups from mainly nurses, and particularly white nurses. Um, the assistant manager, she was Black. One of the nurses that was Haitian. So we're going to be getting into a lot of information on um, what Black women are experiencing in labor and delivery as Black nurses. That we are held to a different standard than our white counterparts. Every Black woman know when you go into these hospitals, all you gotta do is just look at the pictures on the wall. All you have to look at the brochures that they send you. When you look at those pictures on the wall, try to find the Black families. Try to find that Black man, that Black woman, and that Black child in those hospitals. There are few far in between. If you do see a Black man, he's with a non-Black woman. My goal is to finally reveal what I experienced as a Black nurse working in labor and delivery. I understand why Black women are 3 to 4 times more likely to die having our babies because people don't want to admit it. But the common denominator is fucking racism, white supremacy. And who is the top leading nurses in labor and delivery? YT women. And we don't want to admit that. When it come down to Black women having the same disease as any other race of women, why are we dying the most? And I will be exposing what I went through at this hospital. I have over 392 pages of an EEOC file that I had against this employer. And I tell you, having babies and being Black, I see what they mean by A white nurse or the medical field is like the police to a black man. Yeah. Now that the two incidents have been videotaped with Miss Jones and Miss Mercedes, now all these white folks, all these white nurses and these white providers want to come out and say that's just for clicks and likes. Because see, when Miss Jones was in that ER, screaming and hollering in that wheelchair, did y'all see the body language of that white nurse? Did you see the other video when that young man was on getting out of the car and they was putting him in the wheelchair, not on a stretcher? Did you see how Miss Vaughn's attitude was to the girlfriend who was recording? This is what black people face in the hospital with white providers. And I'm not saying all white nurses, but I'm just talking about them labor and delivery white bitches. They're conniving, they're evil, and boy, when they get to crying, everybody listen. I came from a department where my director was a black woman. I interviewed at this hospital, and I was supposed to be the assistant manager, nurse manager of operations, the ANOM. But when she told me about what she was experiencing as a black director in a unit full of white women as well as non-black women, I'm gonna call them POCs. And when I say POCs, I mean other people of color. We had all kind of Caribbean people, and I'm not just saying Jamaica and Haiti, because when people think of Caribbean, they think about Jamaica and Haiti. I'm talking about all the other islands, the Latinas that identify as white but got them black baby daddies and come up in them labor rooms and mistreat black women. I saw y'all and I reported y'all, and that's why you're mad. See, I once was a young mother at 23, and I had my daughter at this same hospital, and I experienced the same thing. But at the time when I had my daughter, it was older white nurses. Black women, when y'all go into these hospitals, you need to take an advocate, whether he or she is a doula, your mom, a sister, and the father of the child is going to be there, hopefully, if you can. You need somebody to be able to speak up for you when you can't speak for yourself. And it doesn't matter, black woman, my sister, if you are educated or uneducated, you got lots of money or you're on welfare. They're killing us in these hospitals. The same treatment that every preeclamptic mother goes through for the medication, the hypertension protocol, we use that on all the mothers across the board. Labetalol, hydralazine, magnesium sulfate to help prevent you from having seizures. And we keep all mothers on that 24 hours after they have the baby. But why are black women dying having our babies? They tried to take out Serena Williams, and she came in there with a whole white man, a husband. Ain't he a billionaire? Then I'm understanding Beyonce went through something. Judge Hatchett daughter-in-law went for a repeat scheduled C-section, and 8 hours later, by the time they listened to her husband, it was too late. And usually, when we care for people of status, we are more alert. We pay them more attention. See, because I worked at a hospital in Georgia called the Baby Factory, where they deliver all the stars in Atlanta. You know, they have diplomats come there. But one thing I do know, black nurses did take care of those rich white patients or those rich black patients. It was always the white nurses. Yeah. See, when you start getting into, advertisement, how these hospitals want to, show you what they represent, is always that white woman or white looking woman and that white looking man or that white man with a beautiful black family, because the hospital that I was working at before I was terminated, on their website, that white woman had a man, that Asian woman had a man, but you know what they had that black woman in the bed with? Her fucking self and her baby. And I voiced my concern about that. There you go, perpetuating the stereotypes of the single black mother, the welfare queen. And we all know who gets the most welfare. See, we live in a racist country. Always been racist, will ever forever be racist. You think they created welfare to help the black woman? No, that was for the white woman. See, that's why I understand why Trump and the Republicans, the Republic KKKians, are trying to, take black history out of schools, because who wants to always be inundated with what did wrong to us? I know. What does this have to do with labor and delivery? It has everything to do with labor and delivery. It has everything to do with black maternal mortality in these labor rooms. But nobody want to have this conversation until it's time to get monetized and get clicks and likes and views. Women that look like me, whether you're from the islands or Africa, when you come to America, and I'm not saying all of y'all, but some of y'all can be a tad bit uppity, right? Back in the day, they used to refer to the black people here in America as uppity Negroes because we didn't know our place. And I'm not saying you don't know your place. What I'm saying is you don't know these white folks over here. They will kill you and get away with it. And then they will get those nurses in labor and delivery and those providers to do that root cause analysis to see where they can shift the blame or where they can hide. Yeah. I was certified a legal nurse consultant. Again, I won my first case. Now, granted, this young lady was hard-headed AF. The doctors documented that if you don't regulate your blood sugars, you can have a dead baby. Well, when she came to the hospital, the doctor's office, with complaints of decreased fetal movement, and that's a lot of complaints with black women. We just had another incident with a black young lady, went to her hospital with complaints of decreased fetal movement. They put her on the waiting list for induction. And I think if I'm not mistaken, she was over 40 some weeks. We got a lot of stuff to talk about, but I'm going to stay on track with this one. And they don't listen to us. We come back days later or weeks later, and we got a dead baby. Anytime, black woman, when you go in that hospital, since we have that My Chart where you can get that little tablet that all the hospitals want to, they made a lot of money off of COVID. And hospitals make a lot of money. They get a lot of grants off of black dead and injured women and children. Oh yeah, we got a health department down here that just got $2 million in 2023 off of black women in preeclampsia. The hospital that I was just fired from last year, they was applying for a grant for preeclampsia. So these motherfuckers is getting a lot of money off of dead black women and babies and injured black women and babies. So my job as a nurse is to help black women not be a victim anymore. So when that black woman called that hospital and they put her on a list for induction, and we'll call you back, and they never called her back. See, I'm a labor nurse. I'm on the inside, so I know what goes on. So at this particular hospital, now they're building a new hospital down here. So I don't know how many labor rooms yet, but I'll find out. But the current hospital where they're operating out of, they have 12 labor rooms. So that means we should be able to accommodate 12 women. However, if you are short of staff, how can you accommodate 12 women? Each labor nurse can work up to 2 patients, right? And it depends on if they're in active labor. Are you pushing? Are you having to do interventions because this baby is having decelerations in his heart rate? So you can't be in 2 places at one time. At this hospital, they wouldn't even document on the patients when you gave them report. Hey, Alice, can you watch room 12 while I push in room 1? The whole time you pushing, and sometimes it takes up to 3 to 4 hours to push, depending on your coach. Oh, first time moms have a tendency of pushing longer, but when I have my labor patients, because I've been doing this for 18 years and I got things in my arsenal that works. And other nurses have things in their arsenal that work that I don't like, but they like. So to each his own. That whole time I gave a report to a nurse for an hour and some change. She never documented on the patient. But I'm so glad that I took the time to put, hey, report gave to Allison at 9:25. So from 9:25 to 1:25, if you ain't charted, you think Nurse Miko gonna go back and chart? I wasn't in there. So black nurses working in labor and delivery, CYA and CYL, cover your license and cover your ass. Because I'm telling you, these will have your ass up under the bus. And you know what's sad? Your own black people will help them destroy you because they're jealous. I felt that I was blackballed because I wasn't like the average black nurse. I came in I would have my head wrap, I have my hoop earrings in. At the time I had gold braces. I've always wore my aviators. I was always professional. And sometimes I will look like this. But what I realized, these people, when a black person, especially a woman, is not, they don't like that. So if I come in there like this, oh, I look like I got attitude. But did you not take that culturally sensitivity class? See, when black women stand in their power, it offends the white nurses. I'm just talking about labor and delivery. I'm not talking about any other department. Any other department. See, this is why black sisters are dying in that fucking labor room. And then another thing that I noticed, your POCs, your people of color, and I done said it 50 lamb times. Black women die when white women cry. We don't only get it from the white nurse. We get it from that Haitian nurse, that Jamaican nurse who think when they come over here, they think they're better than the black Americans. I'm not saying all of them, but the ones I work with, we get it from the Filipino mafia. We get it from the Latinas. Especially the ones that date or have babies by black men. You all hate black women because you think because you're getting the black D that you better than us. And then you go and have your mixed babies and then you think you still better than us. But you forgot that black man came from a black man and a black woman. Unless otherwise. And this is why black women are dying having our babies because of racism. So they done changed it to bias and implicit bias and all this kind of shit. But y'all quick to say we all children of God. We all took the NCLEX, right? We all took some form of RN program, the same program that y'all president is trying to attack and say it's not a professional program. The RN is not a professional profession. And we've saved countless lives. Not even in the hospital, just on the street. I remember I was on a Sprint airline coming from Jamaica, and this man had asthma problem. And they asked was any professional or RN or a doctor on the plane. And guess what? I didn't say, if he a white man, I ain't gonna help him. I just saw a human being in distress. But when it come down to women that look like me, y'all kill us. You really do. And I sat here and watched a lot of videos about these two black women. You mean to tell me that this young lady was in labor for 6 hours and okay, she said she was 3 centimeters. And depending on the size of your fingers, fingertip, if I can get one finger in, that's one. If I can get one and a half, that's two. If I can get two nice fingers in, that's three. Everybody dilations checking vaginal checks are subjective. Because I worked with a mandingo in New York, and he used to just check people with one goddamn finger. You ain't want Dansko to put fucking two in there, because it's just like having sex. That's how big this man fingers was. And he was a PA, and he was a damn good PA, and he was very professional. So when them women saw this big black man, mandingo coming there, they was a little intimidated, but we always had another nurse with him. He never went in there by himself. He was always professional. So each vag exam is subjective, but I'm gonna let y'all know 3 centimeters is not active labor. Now, even if she was saying she was contracting every minute, that was concerning in itself. Why wasn't she admitted? This is her fourth baby. She is a multip. She can go anytime. And then she never saw a provider. And you notice it was dark outside. Can I tell you the secrets what goes on in the labor room after dark, night shift? Them fucking doctors are sleeping. They're either home, sleeping, taking care of other patients, can't come see you. Nurses discharging patients without the provider seeing them. This is what was going on at this hospital. So that new hospital the new women's center that they're building down here, it's gonna be the same fucking thing. Yeah. So when that young lady was discharged, all to give birth 8 minutes later on the side of a fucking road, and then excuse me, she had to be readmitted after she had the baby. She went home and had to go back to the hospital. So they didn't say what happened. So I don't know if she had preeclampsia, which is common to happen after birth. A lot of women get readmitted. So when you have a readmission to the hospital for those types of ailments, that takes staff off the floor. So now we got to put her in antepartum. For some reason, I don't even know why postpartum nurses they act like they can't even deal with magnesium. Baby, you a nurse. You a maternal child health nurse. So you should know how to do these things. But no, they take up a labor nurse. See, a labor nurse can function in postpartum, right? But a postpartum nurse, if she don't have no labor and delivery background experience, she cannot function in labor and delivery. We need people who know how to read those fetal monitorings. We need people that know how when we have a shoulder dystocia, you need to be able to jump in and do preventative measures. So that's why when I go to a department, whether I'm a travel nurse or a staff nurse, and that director or that manager has no labor and delivery background, that's fucking concerning to me. Because if we need you to come your ass out that office and take a patient, you don't know what to do. And that's what we had down there at this hospital in our community. When I tell you nurses eat their own, the older nurses eat the younger nurses. The younger nurses try to sabotage the older nurses, and then the younger nurses fuck up with Yeah, they get into it with the younger nurses. So it's just like a lateral vertical violence. And they even said that I was sit in the corner and I wouldn't communicate. I didn't know you had to go to work and have friends. Your coworkers are not your fucking friends, especially they want to know your fucking business and use that against you. I damn sure can't hardly trust the black ones, but you really think I'm finna go in there and tell you all my goddamn business so you can have it in a white group chat? These are the conversations we need to have while I'm sorry, black women are dying having our babies. I'm not reaching. I ain't even fucking preaching. I'm telling the God's honest truth. Because if white women, that's my grandmother, if white women were dying at the alarming rate that black women are dying having our babies, trust me, should have changed. I just came across a book, I think it's called When She Owned Them. It's about white women back in slavery times owning, you know, other black people. And how you thought that white man was vicious, the woman was just as worse. But these are the conversations we don't want to have because they are sensitive. And a hit dog will holler. Just like they say the black woman, we give birth to the ghetto and we ghetto fabulous and what else they say we are? We welfare queens, we baby mamas. You know who was the first deadbeat dad? Her son. Her son. Raping my ancestors and having those mulatto mixed babies and wasn't taking care of them. That white woman pushing up on them black slave men, trying to get that mandingo D and having them mixed babies. And them midwives when clamping that cord and was letting them babies bleed out when they came out looking black. Then that Black History book, Black History SF, when that black midwife was switching up them goddamn babies and the mixed babies were being raised in the household, and they would take the white woman and the white man baby out, and she'll swap them out. We did what we had to do to survive. You be shitty to us, but we still got to be nice to you. Black women, help me help you survive. When you go in these labor rooms, have you somebody with some sense in them. Always document. Go in there with a notepad. I'm talking about this size or bigger. You have a question, you write it down. You always have that whiteboard in that labor room filled out. So at change of shift, you want to know who your new provider is because sometimes the providers sign off. You want to know that phone number to your nurse or to the nurse's station. Your call out should always be within reach. You want to know who your PCT or your tech, your CNA, the LPN, you want to know everybody in that damn department who's going to come in your room. If you on magnesium sulfate, that RN should be listening to your breath sounds every hour. She should be checking your DTRs, your deep tendon reflexes. Now, if you got an epidural and she banging on your legs, shame on her. She should be checking your urine output hourly. But sometimes, because we are really busy with other patients, we can't come in your room like that. So if you need ice water and your husband or the father of your child is in that room with you, have his ass get up and go get you some ice water. Because a lot of the nurses, hospitals have the nourishment room that is accessible to family members where you can get your coffee, go in the refrigerator, That's what they're there for. So extra blankets. You call on the call bell. Hey, um, how may I help you? I need my nurse. And no, some of them dumb people in the hospital don't. Can she bring you anything? You calling that call bell, sisters. You give them the who, what, when, why, and where. Why you want your nurse? My pump is beeping in here, and I need some blankets. I'm cold. Can I have some ice water and a warm blanket and an extra pillow? Instead of every 50 damn seconds you on that call bell, because that does aggravate us. Just write it down. Let us know. Because hell, we humans too. We got shit going on at home. And we got to come in and act like everything is okay. And then don't be a fucking black nurse working in labor and delivery with our you think we got that shit easy? Especially if you be one. And I've always said, when my mother and her husband conceived me, they did not know I was going to be a female or a male, but they knew I was going to be black first. So I'm black before my religion. I'm black before my spirituality. I'm black before I'm a woman. Because if I go up and hit somebody upside their head and attack them, and when they call the police, they ask for a description, they're going to say, what does the suspect look like? Oh, she was a black female, had on an army fatigue headscarf, a black dress, and some wooden earrings. So you think they're gonna go out looking for a white woman? They're gonna look at every black woman that they see, looking for this description. So once you say black, you alleviate everybody else except for that African and that black Caribbean, Jamaican, or Haitian or Belize. You look like me. They're gonna be looking for your ass. And this is just to tell the truth. I'm working on a PowerPoint about meconium because in the video, um, Miss Jones was saying how, well, her mother was saying how the baby had his first bowel movement and he was born with his eyes open. There's nothing wrong with a baby born with their eyes open. Nothing. That's normal. Now the meconium, when a baby shit before it's born, something happened. That baby got stressed out. So you scared the shit out of me. Something happened in utero which caused that baby bowels to release. And depending on the color also matters. Is it yellow? Is it dark green? Is it meticulate? Is it with vernix, which the cream stuff that be on the baby? All this makes sense. So when you don't notice, you'll get on the news or get on the internet and you'll sound unintelligent. So because he was born with his eyes open, that's why we do the erythromycin in the baby's eyes to prevent any eye infections. Because the vagina and the asshole is right there. So we don't have moms shit all over the baby. That's normal. That's why as you're delivering, that doctor put that blue drape up. We try to keep it as sterile as possible, all that kind of stuff. But a vaginal delivery is not a sterile procedure. It's not. Ain't nothing clean about the vagina. Nothing. But we do things to cut down on infection. That's why we don't like doing frequent vag exams, because you introducing germs, bacteria. Yeah, you should wash your hands before and after. Those gloves have really micro, holes in them. You never know. hmm If you're overweight, you got a lot of flesh down there. If you unclean, you put yourself at risk for infection. Sexually transmitted diseases, GBS, which is not a sexually transmitted disease. It's just a overgrowth of bacteria in the vagina that is normal for mom, but it can really kill a baby. That's why I understand why y'all eat your fucking placentas. That's another topic. That's another topic. I'm not gonna even get in that today. Oh boy, another topic. I'm about to do some more research over that shit right there, cause that's beyond me. Beyond me. Hell, I used to eat chitterlings, so hey. Until I found out what the fuck it was. No wonder it stank so goddamn bad. It's fucking intestines. It's the shit house. But hey, people licking ass and eating ass, toasting salads, strangers doing the Monica Lewinsky on a one night stand. So, people doing some crazy sexual, they got some crazy sexual habits, but that's not what we're talking about. We're trying to save black women from dying. My goal is to annihilate black women from dying having our babies. Right? A lot of us don't even have a primary care provider. We don't go to the doctor. When we find out we sick, that's when we find out in pregnancy, because in pregnancy you tend to go to the doctor for prenatal care. And you got all these people on the internet and this home birth and these, we call them not coconuts, but tree huggers or granola people. I'm just going to say this because I'm not going to be on here long. I already overdid this 37 minutes and 2 seconds. When things go bad in the labor room, I'm gonna do I think I could do a broadcast on that, a topic on when things go bad in the labor room. I'm telling you, that shit go bad and it go bad fast. And you need a quick witted, critical thinking nurse and a fucking provider. Everybody need to be ready. So when mom's coming in, oh, I don't want an IV, I want least invasive, I want this, I don't want that. This is, baby, stay home. Stay all the way home until you damn not ready to have that baby. See, because when you come into the hospital, these are the things that we do. Now, not having IV fluids running, okay, but you still need an IV site. Do you know what it's like to try to get an IV in a bleeding mom that's bleeding profusely? So when you're bleeding out, your veins collapse. So it's harder to find veins on a collapsed venous system. So it will behoove you to at least have an IV site. And if you have any bleeding disorders, like the hemophilia, the von Willebrand and Willebrand, all that other stuff, have 2 IV sites. I'd rather be safe than sorry. Because what I notice when something bad happened and you try to blame it on us, I'm going to end on this note. I was doing a delivery, a water birth at a hospital in Georgia. And in order for you to qualify for the water birth, you had to have intact member. Don't get me started on the qualifications, but this lady, water broke 2 weeks prior, allegedly 2 weeks prior to her coming in. And her doctor was a black doctor. And he's a damn good doctor because I worked with him at 2 hospitals. You know that young lady sat there and lied. Lo and behold, her water had done broke 2 weeks prior to her actually coming into the hospital. Right? That's how bad she wanted a fucking water birth. She put her son at risk. So she never had a temp. Her highest temp was like 99 point something. A fever is anything over, is it, I think it's 100.2. That's considered a fever. Well, she never met that threshold. And it's probably because, she was in the water. And she labored and she delivered. Baby, when they pulled that baby out that fucking water, it smelled like hot shit. That baby was so damn stank. And he was seasoned. Come to find out, her water had broke 2 weeks ago. And she didn't ever call in and come. Because, see, women think once your water break, your body go into labor. It does this. It's supposed to do this. Not all women bodies respond that way. Some of them need a little help. That's why we use Pitocin. Or they're just trying to rush the birth, this and that. Let me tell you something. It's called labor and delivery, not labor and wait. When you're in that room for 3 days, you're putting yourself more and more and more at risk for a postpartum hemorrhage. So that's why we do what we do. We want to get you in and we want to get you out. Not saying that we rushing your labor, but because we only have 12 rooms and we don't have a lot of staff. Some call off. Some we just don't have. You got women coming in us some nights. We be busting out the scene. Women, we love them stop and drops. We love women that come in there like Miss Jones did, ready to rock and roll. We got one nurse doing the IV. We got another nurse hooking up to the monitor. You got the primary nurse probably trying to do her admission between contractions. We tag teaming that ass. We got another nurse bringing in the Pitocin. If we can't get an IV in, we got fucking IM pit ready to hit your ass with it so you don't bleed the fuck out. But these are the things that a lot of we want to make labor and deliver a beauty, and it is a beautiful. It is beautiful. It is gorgeous. When it's gorgeous, shit. When you go to fucking Jiffy Lube, you going to get your oil change, right? You ain't going there to get your tires rotated, although some Jiffy Lubes do all that shit. But you're going to get your oil change. Why you want to be talking about the damn carburetor? All that go together, but we here from oil change, if that makes sense. And I don't want people to think that I'm advocating for a rush delivery and all these invasive procedures. No, if your labor is progressing, but if you stuck and you need a little help, let's do it. If your car break down because you got a flat tire, keep rolling on that motherfucking flat tire and see how you damage that rim. Instead of just getting a new tire, you're going to need a whole new shebang. Rims, probably depending on how bad you fucked it up, you may need a brake pad, rotors. And this is what I want to tell my Black sisters to help me help you. Because one day I know we all got to die. But you don't need to be in that fucking funeral home before it's time because of somebody that like me that don't like themselves, don't like you because they think you a tad bit too fucking ghetto. And back to that nurse Vaughn, that white nurse that got on the internet talking about her hospital and she was a nurse there and she got 4 kids and this and that. You worked in the same department as Nurse Vaughn, that redhead bitch. And you sat there and y'all, you are the 2 snakes of the same kind, different mamas and daddies. You're a part of the problem. Because when you don't report other nurses' bad behaviors, you're a part of the problem. No, that's what my black director told me. Oh, say their names. So when I start giving fucking names, they got my ass up out of there. Oh, wait a minute, this bitch here. Mm-mm. All right, that's what you told me to tell names. That's what I did. 80% of maternal deaths are preventable, according to the CDC. 80% is preventable. The 20% that's not preventable is the one case I had was when my patient, who was a white woman and 33 years old, having her third baby with a black baby daddy, beautiful white girl, beautiful white girl. She had her white nurse, older white lady. Mm-hmm. I was giving her a 30-minute break. The doctor had just come out the room from doing a vag exam, and she was about 5 centimeters. I had just given her some fentanyl and put her in a fire hydrant position. This was before we had peanut balls. And I love my fire hydrant position. And she was thrombocytopenia, so she couldn't get an epidural. So she was at risk for bleeding. And she did not have a second IV. And when we got her when she threw that amniotic fluid embolism, when the fluid around the baby got outside the uterus and got into her bloodstream, that's a medical emergency. We coded that sister for 2.5 hours. 2.5 hours. Her nurse never came back to take over her fucking care. And you know that white woman was the first woman to leave? My shift ended at 7. I didn't get home till after 9 o'clock. Making sure everything was documented. And when you're going through shit like that, you can't document on real time unless you have somebody specifically in the OR that's doing the documentation. And I was training another black young lady on a travel assignment. That girl never fucking came back. Never. The CNO, the CFO, they were all looking through that fucking goddamn OR door window. I've never done CPR in my life on a real human until that day. October the 4th, 2014. Yeah. We tried to do another IV, and I'm damn good with IVs. If I can feel it and see it, I can stick your ass. That girl bled out. She went into DIC. Everything. We got that baby out in about 7 to 8 minutes, which is fucking good. That's from coming out that room to birth time. So when we have these babies, we focus on these beautiful, lavish baby showers, but we don't understand the dangers of that labor room because of. And I'm going to say it again. We focus on those lavish, beautiful baby showers with the baby going well, all the pictures and all the pacifiers and all that shit. But we totally forget that fucking labor room, how dangerous it is because of. And I may get some flack for that, but I'm here for the shit because it's the truth. Black women are not dying because we are uneducated. We poor. We this, we that. We're dying because of nurses, medical providers. These here black staff who are afraid to speak up and say something. That's why we dying. Now y'all be safe having them babies. I got y'all back. As long as you got mine, I got yours. As long as you have my back, I got your back. See, because when I was in nursing school, I had to do that swear. I swear to tell the truth, to do no harm, blah, 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 blah. When I went to get them jobs, I have to take if you see something, say something. But as soon as you do, because it's coming out of a black face and a black mouth, see, niggas supposed to be seen and not heard. But that ain't how the world work no more. See, because women that look like me is dying having their babies. And see, I have a daughter that one day gonna be a mother. I have sisters and nieces and nephews that girlfriends and wives gonna have children. And I be damned if they go up in these hospitals with sickle cell disease and you under medicating them, accusing them of drug seeking. You're not adequately managing their labor because you don't want to get another patient. You think the baby daddy smell like weed, or you think they too ghetto, or better yet, too bougie. These are the things I heard from in POCs. I only been doing this for 18 years, from New York, Georgia to California to Florida. I couldn't even get my first L&D job here in Florida because at this same hospital, they told me I wasn't fit for the team. That's why I was so surprised to see a black director. You know, the hardest thing for a black woman to do is and be a nurse and be in charge in the department is to be in charge over white women. I'm not saying all of them, but a great big fucking handful are some evil, nasty ass white nurses.